everyone. Thank you. All right, awesome. So first I want to start off to give a little overview. I know many of you have been here before for BHA Technology office hours, but in case you are new, BHA Technology office hours is held monthly on the second Wednesday of the month at 1 p.m. The sessions are typically intended for behavioral health providers and data or admin team members. We usually give updates regarding a variety of topics, including news and improvements related to BHA technology systems. We will provide answers to technology questions from the BHA tech team. We often give ideas and tips from, ideas and tips from others in the field are often provided. And then there's usually opportunities to further engage with the BHA tech team. So that's just a little bit overview. If you have any questions about that, feel free to drop them in the chat. And as always, you can come off mute or drop your questions in the chat. So we're gonna keep going. Here's the agenda for today. First, we're gonna do a little bit of a Learning Hub introduction. I think we've talked about the Learning Hub a little bit before in previous meetings. There will be a BHA website update and engagement opportunity. Talk a little bit about technology training updates, client care search updates, an update regarding care coordination, and then lastly, an update around the behavioral health claims and eligibility project. So, all right, I'm gonna pass it off. I believe Andrew or David. I can click for you. Just let me know when you want me to advance the slide.
Thanks, Amanda. Good afternoon, everyone. My name is David Sin. I am the LMS manager here for the BHA in Technology and Data. I'm one of the program managers that helped create and launch the OwnPath Learning Hub that was officially launched in April. Just a point of clarification, if you guys might recognize the term OwnPath. OwnPath is the brand for our care directory, and further clarification, if you guys don't know this already, OwnPath is becoming a parent brand for technology offerings and technology products and various products within the BHA, and the Learning Hub is a child brand underneath OwnPath. It's actually one of the first in there. So if there's some confusion of why we're calling it OwnPath, you will see not only Learning Hub and the brand and logos that you're familiar with, but you will likely see other brand offerings coming in the near future underneath that same name. So I'm going to introduce you to Andrew Kemp, who is our product manager, and he is going to walk you through the slides. Drew?
Yeah, that's great. Thanks, David. Welcome, everyone. My name is Andrew Kemp. I'm the project manager for the OwnPath Learning Hub. Amanda, if you mind moving forward to the next slide. And so where did the genesis of the idea for the product, the Learning Hub product, come from? It was created in response to the Senate Bills 21-137 and 22-181, which were formulated off the back of the COVID crisis, where various workforce task forces went out to look into the behavioral health services within Colorado. How could they be improved, and developed a strategy for making services more readily available. So the idea of Learning Hub was generated from there, with the key objectives of it becoming a free product to help support the expansion of behavioral health services within Colorado. Free is an important part of that to remember, and also how could these services be offered in a way which was equitable and accessible to all of the citizens of Colorado. One thing we often worry about is that Colorado isn't just Denver and Colorado Springs and Boulder Valley. There's a lot of area to cover there, and so providing an online service is a great way to lower the barrier of entry and ensure that everyone has equal access to services which will help expand the workforce. As David mentioned, the platform officially launched in April, and we did have a soft launch in March where we were able to release some early courses and get feedback, and some of that data will become apparent as we move through the deck. Amanda, if you could just move forward one. So what content do we have on the Learning Hub? Well, right now we have 30 courses inside the Crisis Professional curriculum. 30 out of 32, the remainder of the courses should be online and available by July 1st. That will support our Crisis Professional licensure. So we will find that there are existing crisis professionals who are looking to renew. They will be able to do that from July 1st. And then anyone looking to enter the workforce as a crisis professional, there'll be an online suite of courses designed to help them do that. We also have a set of standalone behavioral health courses as well. These are across a range of topics, including cultural responsiveness, children, youth, and family. We have 22 of those courses right now, and we currently have more in development. Future topics that will find themselves a home on the Learning Hub include disability, cultural competence, criminal justice, peer supervisory, etc. Those courses and other roadmapped content will bring us up to potentially up to 300 courses by the end of next year. So quite an exciting time here where we're building out a lot of content and increasing the usefulness and the range of courses that people can access through the Learning Hub. Amanda, if you could move forward one for me, thanks. So why would someone use the Learning Hub? Well, we talked about crisis professional licensure, so that's one reason that people are driven to the site. Some other reasons that make it a compelling location for people to access training. We have continued education units for a number of our courses. We currently have 12 right now. We have a large number that are in the approval process. So we expect to expand that number considerably. And accreditation is something that we are looking to kind of weave in as a standard offering into courses as much as possible to help drive and give motivation for people to come to the platform. I think I mentioned free before, and I may mention it 3 or 4 times before we get to the end of the presentation, but just in case you didn't notice, the courses are free. The courses are accessible, so we spend a lot of time making sure that the courses follow best practice design guidelines, that they have transcription services, there are subtitles or captions where needed, and we try and just make sure that that barrier of entry is as even as possible for people regardless of their position and their capabilities. And of course, the Learning Hub platform, like most websites nowadays, is accessible through multiple different devices and platforms. You just need a browser to be able to get to the site. And there is a Brightspace mobile app as well, so that people can log in as well from tablets, computers, regardless of what your device is, you should be able to get there. The platform does remember your progress. So if you have a 30-minute period where you've got some downtime and you want to go learn, you can go back, you can go in and pick up a course. Courses range in length from typically 60 minutes is the average length of course, and then there's a couple that are 2 or 3 hours depending on the subject matter there. Amanda, if you wouldn't mind advancing forward. What do we think makes the Learning Hub successful right now? Well, we put a lot of time, effort, and energy into ensuring that the quality of the content is there. The diagram on the right-hand side is too small for you to read, I'm sure, but the idea that we want to drive across is that each of those horizontal phases there is a place where there are professionals looking at the content and reviewing and approving and re-reviewing and assessing the content to make sure that it's accurate, that it's up to date, that it's accessible to all, and that's make sure that we have a really strong quality assurance process in place to make sure that the content is accurate as well. In the ever-changing field of behavioral health, there are often updates to different processes, to frameworks, ways of thinking. So we want to make sure that the content we push out is up to date and as accurate as possible. We do have an EDI expert who assists the team as well. So we are ensuring, or we're making our best attempts to make sure that the language that we use reflects diverse identities. The images that we use are culturally competent and inclusive. We talked a little about accessibility, so just ensuring that people of varying means can access the information, and that we want to make sure that all our training resources, our content creators are all working in alignment with our curriculum development plans as well. We put a lot of energy, time, and focus on continuous improvement. So that's that part of the Learning Hub where people can leave feedback that can be on the platform. We have many avenues for people to leave feedback, and we're constantly reviewing that to discover what works well for our learners, what doesn't, where there can be improvements. So we spend a lot of time also looking to make sure that we are responding to that and making sure that we have the best possible product and experience for our learners. We also spend time looking at the data that the system generates. So what that might include would be what does a learner journey look like? Where are people, which courses are people really interested in? Which courses are learners engaging with and then dropping off? Maybe there's a quality issue, or there's some underlying reason why people are not following through with courses. So we do spend a lot of time and energy looking at the data to make sure that it's supporting our learner journey as well. So if you can go to the next slide, Amanda, we actually have some data here. So this is the usage data for the platform. So what we can see here is that we've had over 1,000 course enrollments in, we're now in May, so this has been 3 months the platform has been online. So 1,000 course enrollments is a great number, shows that we have a lot of interaction there. We have 850 individual learners enrolled. So, you know, fantastic numbers. The chart on the right there just shows the trends over time. So we can see that the numbers are steadily rising. So really great to see that the platform is gaining in popularity and hopefully as a result in usefulness as well. If you can just go to the next slide, Amanda, thank you. So here, this data is actually showing where our learners, our professional learners, are engaged in their services. So we, at the moment, we're breaking it down into rays, so you can see that there's a fair coverage across different counties within Colorado. So we are touching and you know, most of the state there. So hopefully we're making great strides towards that geographically accessible platform that we set out to do. If you can just go to the last slide, Amanda. As I may have mentioned before, courses are free, so we do encourage anyone that's not been on Learning Hub to go there, take a look around, feel free to enroll. Look at the course offerings there. As I said, there are multiple opportunities for people to feedback. So if you go online and you see something that works really well or could be improved, please feel free to use the platform, share that message. And as I said, we do look at that frequently as well. So we're very much open to ideas and comments and questions that people may have about the Learning Hub platform. So thanks for letting me give you a quick introduction, and I will hang around. Dave and I will probably hang around for questions later on as well.
Awesome. Thanks, Andrew. I'll pause for a moment. If anyone has questions, feel free to come off chat or post them in the chat. Andrew, I'll also ask you, if you wouldn't mind, can you drop the Learning Hub link into the chat so people can easily access it? And if individuals do have questions about the Learning Hub, can they contact you, or who is the best point of contact?
Yep, that's fine. I can drop my email in with the link as well, and people can reach out to me directly.
Okay. Awesome. Thank you. Okay. Well, we will move right along. So we're going to move on to BHA website updates, and I believe Melody was going to do this. Is Melody here? Oh, there you are.
Thanks, Amanda. Cool. Yeah, thanks for having me in the office hours. It's nice to be here. I'm Melody. I'm a content design contractor for BHA. My pronouns are she, her, and I'm currently working on a bunch of updates to make the BHA website easier to use. And they're planned to go out this summer. So it's an exciting time. We're kind of getting closer to launching some of the new stuff. And so you can go to the next slide, Amanda. This is an image of our current website homepage that you may be familiar with. Our website houses tons of information and resources to help three primary audiences, really. The top one is you all, service providers, including clinicians, operators, administrators of organizations that offer behavioral health services in Colorado. Important, equally important are Colorado residents, including anyone who might be seeking care. And then finally, government stakeholders, including legislators and state and federal agency employees. So in the next slide, this is just a quick summary of what's actually happening and what updates we're working on. You probably won't notice a big change in how the website looks and feels. This is going to be more focused on content updates. So things like navigation, where like different pages live is going to change. So your pathway to find information, we hope, will become easier with more clear menus and headings and actions to take. We're also working on updates to readability across the site. This is kind of a longer term project, but we are slowly but surely curating web pages and trying to reduce the grade reading level and apply plain language across the board. We are working on auditing information for accuracy, hopefully to build trust with our audiences and just make sure that information is up to date and everything is sort of trustworthy. And finally, we are also doing an accessibility pass at our website and fixing anything that needs to be remediated so that everyone can truly use it. And in the next slide, I just have a quick, like, what's the status of all this work? So far, we've done some really foundational groundwork in understanding, audiences and the things that people who are visiting the website need. A couple of you have even participated in some of the past research, which I'm just super appreciative of and has been so illuminating. We've defined and aligned on key problems and goals for this redesign, the content redesign, and how to measure success. And we've completed early design proposals for solutions. So now we're at a phase where we're ready to test some of our proposed solutions, which is really exciting. And that's where you all come in. So in the next slide, I have quick, how can I help? If, for those who are, invested and curious and or just interested, we will be with my partner, Bianca, who's here on this call, hosting, actually, I don't know that they're 30-minute sessions, but they will be 30 minutes or less, exercises that are basically like sharing a proposal of like a couple new ways of organizing information on the website. And we would really, really love your feedback and you to kind of move through those exercises so that before we make these big changes and kind of disrupt the current status quo of the website, we really just want to run things by people like you to make sure that they are truly going to make improvements and collect any other, sort of input and thoughts that you might have. Bianca, is there anything that I'm missing, or do you want to add anything?
No, I think that was a beautiful summary, and just really appreciate everyone on this call who's willing to help us make the website useful for our providers. Okay,
Right.
the one thing I would add is I think if you share your email with us, we'll be emailing you in about a week. So by the end of next week, you would have an email from us with your invitation to participate.
Yes. So please don't be shy. And if you have the bandwidth and the interest, and or if you're even just kind of curious or worried about, whether you can do it or not, or if you're on the fence, just reach out and we can give you more information and you can make that call. Feel free to put your email address in the chat. And like Bianca said, she'll be reaching out in about a week.
And Melody, I did just want to direct you. We have a question in the chat and I will read this for the recording. I noticed that the ASO map and accompanying info has been removed. Can we add it back?
Yes, the ASO map has been removed from the Get Help page. There is, I don't have the easiest answer on that because I have collaborated with a few different folks on that page. But I would love to learn more context on just the need for that. And we definitely want to have information that you all need up on the website. So we should definitely talk about getting it back up if that's something that is critical. Yeah, is that fair? So maybe also reach out with your email and we will just kind of kick off that discussion so that we can better understand the need.
Awesome. Thanks, Melody. Okay. I'll pause here for a moment if anyone has any questions in terms of the website or the training or the research opportunity. I will say I've been involved internally in doing some research with the website and it's super fun just to get to test things out. So if you haven't done something like that before, it's oddly fun and I would definitely recommend it. So, okay. Moving on to technology training updates. This is or should be me. I know for what feels like probably the last couple of months at these office hours, I have come on and said, oh, we are creating on-demand trainings. That is true. They are taking a little bit longer than we thought that they would. So we sincerely apologize for that. They are still a work in progress. And as soon as we are able to get them up and announce to everybody, we absolutely will. In the interim, we are still offering one-on-one training sessions for like CCAR and any of the systems within TMS like DACODS and DRS. So if that is something that interests you individually, or if you want to schedule a team training, please email us at the provider support inbox and we can definitely schedule a one-on-one training. Again, I really apologize for the delay, but it'll be really great once it's ready. Hopefully in the next 2 months or so, give or take. All right, another plug I wanted to mention on the website. Many of you likely know there is the BHA, there's the for providers option, and we recently updated this page a little bit. And if you scroll down to the bottom, there is a section called BHA Technology Systems, and we included some systems like Central Registry, Client Care Search, CCAR, as well as TMS. So this is a really great place. I would definitely, bookmark this page, scroll to the bottom, check it out. But there's a lot of information that we added there, as well as training guides and links and things like that. So definitely check that out when you get a chance. Okay. I'm going to pass it off then for client care search updates. And I believe this is either Jordan.
This will be me.
Okay, sorry.
Yeah, no worries. Thanks, Amanda. All right, so you can go to the next page. So this is just a general update. If this applies to you, you will have already gotten an email from me. This is just kind of an update to other folks that maybe are not part of this user group that will be onboarded in this initial push. But we are really excited to be able to announce that we'll be launching our client care search as of June 17th, so next week. And we already have training scheduled that week, so people will start to trickle into that system. And if you're wondering what is client care search, you may have heard this referred to as the bed tracker or referrals, but the official new name of the system is client care search. And again, this is a system where inpatient and residential behavioral health providers will track their bed availability, and where care navigators can then search that information for client placements. So like I said, this product goes live on June 17th. Relevant providers will have until August 1st to get trained up on the system and begin entering their data. I have sent a personal email to every single provider organization that will be onboarded into the system. So if you are relevant to the system, you will have heard from me, or your organization will have, and I will be the person who will be coordinating and performing those trainings. So all things client care search, please come to me, and I will drop my email in chat as well. Why does the BHA have this tool? This is a legislatively mandated tool, 2760-104.5. If you want to look up the revised statute, it's the law states that the BHA must create a bed tracking system, and it must dictate that providers update their bed availability into that system every 24 hours. So this is the system that will be accomplishing that legislative mandate. Users can get tech support the same way that you get tech support for any BHA technology system, which is our provider support inbox listed here. That inbox is monitored from 8 a.m. to 5 p.m. Monday through Friday. And it helps us to sort, if you put in the subject line, which technology system you're looking for support on. Just a little bit about how data from client care search will be used. Data is going to be used to validate that providers are remaining in compliance with this legislative mandate for having updates every 24 hours. And then data in aggregate will sometimes be used to do analysis on Colorado care navigation. And then, of course, for the care coordination support that we mentioned, looking for those client placements. How do you get access to client care search? So access for this initial launch is going to be limited to organizations that hold BHA licenses and designations and that have beds. So we're focusing on getting those organizations into the system and updating their bed availability on a regular basis, so we have good data. And then we'll slowly be adding folks to the system over time, say from other, intermediary organizations or state agencies for care coordination tasks. If you were not contacted by me and think you should have access to client care search, you can feel free to email the provider support inbox. And again, I'll be putting my email in the chat as well for any triage. So that's all I got. Amanda, I'll hand it back to you.
Awesome. Thanks, Abigail. I want to also put the plug in terms of, often on provider office hours, we say to email the provider support inbox, which is 100% true. But it is so helpful when some context is provided in the subject line, like Abigail said, for whatever that might be, the client care search, if it's central registry, if it's TMS or CCAR, just really cluing us in on what maybe you or a provider is reaching out about. We often will get emails that just say, I need my password reset. And we have a lot of systems, right? So it's just so helpful to really be specific in that subject line. So I just wanted to add that plug. Pause here for a moment if anyone has any questions in regards to the client care search.
This is Kevin Hobbs. I got a quick question, probably for Abigail. When are we going to stop putting into EM resource and start using this directly for those that do their bed updates?
That's a great question, Kevin. You can stop doing that as soon as you get trained. So on your training date will be the last day that you have to input data to EM resource. Great question.
All right, thank you.
Yep, thanks, Kevin.
This is Sarah. I've got a quick question, and you may have answered this. I responded back to the email and hadn't got a response, so I'll ask it here. The training, is that just for anyone that will use the platform, or can certain people in our agency be trained and then we train the others?
Sarah, that's a great question. I'm actually working on so it's taken me a little bit because I'm working on a response for you on that. So if you can just give me
awesome.
a couple more days, I'll get back to you if that's okay.
No problem. Thank you so much. I appreciate it.
Yeah, thank you, Sarah. And then we have a question in the chat. Does this mean that ASOs and crisis providers will be able to access client care search to see who has beds available? Elizabeth, this is what that means. So if you're, again, like I'm saying, the first couple of months, or at least the first month, so from June 17th to that August 1st date, we're focused on getting the providers that have the beds in the system. And then after that is when we're going to be training up additional organizations. So I can get back to you on that if that's okay. Thanks, Elizabeth. Yes, and Sandra, yes, I'm going to, when I have an answer for Sarah, I will think of a way, Amanda and I will collaborate on a way that we can share that answer more broadly with the rest of the team. And this is very much connected to what Amanda was talking about around training on demand. So we're just in a little bit of like what I call a mullet phase, which is, we're in the grow out phase. So we know where we want to go, but it's taken a little bit to get there. So thanks for sticking with us. And yeah, we'll share that more broadly. Thanks for the question.
Okay, perfect. Thanks, Abigail. All right, now we're going to move on to care coordination technology updates. And I believe this is the one that was for Jordan.
This is hello. So if we have not met before, my name is Jordan. I use she, they pronouns, and I'm here to talk to you a little bit today about some care coordination technology changes at BHA. Next slide, please. Thank you. So effective July 1st, BHA has expanded responsibilities to provide care coordination to people who are on terminated certifications or are deemed incompetent to proceed or on an involuntary short-term certification. So to support these expanded responsibilities, BHA will be rolling out new data collection forms. So with this, any existing data collection forms that you might be using today from the BHA website related to these programs will be replaced on July 1st. However, with that said, these forms will still be available at the same location you are finding them today at this link. These will be expanded quite a bit and hopefully will be a little bit of a better user experience. But with that said, to help support these new forms, there will be live and recorded trainings available to providers to help in the use of these new tools. To get more information about these trainings, these new tools, all the things of that sort, you can visit the same webpage that I linked previously. But with that said, if you're looking over the website and you're like, I still am not sure what's going on, I have some additional questions about how this impacts my facility, my providers, anything along those lines, I will drop an email in the chat that you can help to navigate some of these changes. And please.
I've got it. Thank you.
Oh, thank you. So with that said, if you would like, again, if you'd like more information or to participate in those trainings, again, reach out to that link, reach out to that email, get in touch with us. But with that said, Gwen, is there any additional context we would like to share at this time?
I would just share that I think for this audience, the people most impacted by this change will be anyone who currently commonly reports terminated certifications via the existing Google form. And if you have questions about who that might be in your organization, again, just reach out to us and we can explain what would be relevant or suggested for you to learn more about these programs and this form in particular. Thanks, Jordan.
Thank you, Gwen. I'll pass it back over to you, Amanda.
Great, thanks. I will pause again for a couple moments, see if anybody has any questions. Okay, well, feel free to drop them in the chat. We are going to move on to behavioral health claims and eligibility updates. I believe Dan or Justin is on.
Yeah, Dan is here and I've got the update for the day. Thanks, Amanda. So for CMHC's ASOs and MSOs, I do have just a quick update on BHC&E. For those who've signed up for Peak Pro training and gotten your accounts, I really want to thank you for taking that effort. We've received some really good feedback from your use of Peak Pro, and that was part of the reason for getting some early Peak Pro access here for your organizations. We are continuing to make changes to Peak, which is the client's path to requesting benefits in the state managed by CBMS. Changes to Peak Pro are continuing, which is the provider's path for requesting benefits like Medicaid or registering for BHA services. And we're continuing to make changes to the Colorado interchange as well. So you'll see things perpetually evolve as time goes on. The real focus of this is to optimize the use of those systems for BHA programs. They're originally developed for Medicaid, so we're continuing to make those tweaks to better, utilize the systems for BHA. We have gotten some recent questions related to what's shown in Peak Pro and the interchange provider portal, where there appears to be a disagreement in information. So I want to touch on that. We did remove some information from the provider portal due to a lot of confusion of BHA services showing up right next to Medicaid, for example. A lot of Medicaid providers thought that this was another benefit plan with guaranteed services, just like Medicaid, and it's not. BHA services are provided by contractors, or I should say by providers who have contracts with the BHA, and those are the only people that are funded by BHA to provide those services. It's not a free-for-all in terms of billing BHA for things like medical surgeries, which we did see some bills submitted into the interchange for people who did not have Medicaid, because providers, made the wrong assumptions about what the BHA benefits really were. So by removing some of that information, we hope to reduce some of the confusion. In Peak Pro, we really still consider use of Peak Pro being in a beta environment, if you will. It's not required by your current contracts, but will be required when the BASOs are rolled out. Some of the questions we've received do indicate a little bit of disagreement, if you will, in the systems. There are some Medicaid approvals for some of the aid codes under Medicaid that do not include behavioral health services. Things like emergency Medicaid or family planning or low income support do show up as Medicaid approvals that don't include behavioral health services. We were able to catch the low income support aid code when we built the system in the first place, but missed the other two programs that I mentioned. So somebody will show up in Peak Pro as having Medicaid and therefore being denied services from BHA, but that's not the case, because the individual still falls under an uninsured or underinsured category because they don't have behavioral health benefits. We're working to fix that particular problem set, but again, because we're viewing this as a beta, this is a good opportunity to find that issue and correct it. You're still can use Peak Pro because it did calculate that the person was Medicaid eligible. So they met all of the financial requirements for Medicaid, which means they met the financial requirements for BHA for the programs that have the 300% FPL limit. But again, you're not bound by Peak Pro outcome from your contract perspective. So your contract still says if the person meets a 300% FPL and they meet other requirements for participation in a program, you can provide them services under your BHA contract. We are still doing Peak Pro training, so I'll throw in a little side note on that. We'd really like to expand the number of organizations that have at least one person with a Peak Pro account for exactly the reasons I mentioned. Get used to seeing what it looks like in your organization. The more people look at it, the more good suggestions we'll have for changes in it. So we really want to keep expanding the number of organizations. We do have a limited capacity right now for doing the training. And we're still working off a backlog of people who had requested training in the past. If we get a request, and by we, I mean me, for a new organization that wants to get somebody into training, we'll bump you right to the front of the line for that. So please keep in mind, even though we haven't advertised for Peak Pro training, we still do that once a month. I should say monthly. There's 3 sessions. First 2 are mandatory, about an hour and a half long. The third session is optional if you've got questions about using Peak Pro or problems with your account, but we are still doing that training monthly. We are working to move the training online so that it's totally online and totally self-paced. Unfortunately, right now, I don't have a good date for you. CDHS Staff Development Division is preparing that training. And as soon as we have a better timeline for it, I'll certainly let you all know, because that'll ease the training bottleneck we do have right now. So that's my quick update. Don't know if there's any questions.
Dan, will you just pop your email in the chat when you have a second?
Will do.
That was one of the questions. I'll still pause though. If anyone wants to come off mute, feel free to ask questions. Okay, thanks so much, Dan.
Yeah, thanks. And again, thanks for all the great feedback we've received from the providers, because you guys are the ones using it, and definitely we appreciate that. Thanks.
All right, so this rounds out our established agenda. I will hold some more space for just general questions that you all might have for us or other providers if you want to ask other individuals on this call as well.
And I did get a response. I'm going to go back to a question we got from Laura and provide a response. So Laura had asked in the chat, is there discussion of OwnPath only listing organizations / providers that are registered with the BHA? That leaves out a lot of providers and limits access. And our OwnPath team got back to us with a response. The OwnPath Care Directory currently includes providers licensed by the BHA, and that our technology team is working on a process to add new providers and allow providers to manage their information and how they appear on OwnPath. We will be working with other state partners like HCPF to collect provider information, and we expect to begin slowly adding providers over the coming months. So I just wanted to come off mute and give that response.
Okay. Future office hours. Here's a list of future office hours for the rest of the year, which is, it's so crazy. You know, when I was making this slide, I was thinking the year is halfway over. I don't know where the time went. And then, as always, if you have any questions, feel free to contact us via email at the CDHS BHA provider support inbox. We will stay on the line if anybody has questions, but this concludes our office hours for this month. Thank you so much for coming. I hope everybody can stay cool today. If you're in Colorado, it's pretty warm out there. So thanks so much, and we'll see you in July. Yeah, Andrew, go ahead.
Hi, Amanda. This is Andy Rose, and pronouns are he and him, and I operate Boulder Emotional Wellness and organize small and solo provider clinics that contract with the Rays. And I was super appreciative and fascinated by the bed tracking pilot public report. It's a great document, and it shows that there's a lot of care being shown for the user experience with the renamed bed tracker. And there was a piece of the report that I wanted to ask about in this data and tech presentation about API integrations. And the reason that caught our eye is we're concerned about accessing provider databases and exposing availability of providers in a similar way to what you're doing for bed inventories, but a little bit on a wider scale for outpatient referral. And so my question is about the API. Since it's in this document, it sounds like something that the BHA considers and thinks about. And I'm just curious if there is a governing idea about APIs, and if we can expect that there would be API access to something like the OwnPath directory, and maybe Abigail can speak to the implementation of the API for the bed tracker. Thanks.
Thanks, Andrew. Yeah, thanks for bringing that up. So the short answer is not in the short term. So we are crafting right now a research plan around API integrations to EHRs to have a comprehensive strategy across all BHA technology products. And that's so that we don't have like one-off, like we will want to go forward to all of you with a comprehensive kind of strategy and implementation for how that would go across our products. So that's really how we're going to approach it, is more holistically. And so we will give updates as we can on that research initiative, like what budgets we can allocate towards that. So it's definitely on our radar, because we've heard so many times across research that really the ideal future we're trying to get to is automatic data pulls. So that's going to save, time, so much time for providers. So we know that that's a future that we're trying to build towards. It just will take us a little time to perform that research, to figure out, what, if any, funding is required, and then to have like a policy that goes across our technology systems. So I know that's not the best answer, but I hope it's a helpful one.
Yeah, sure. That's great. I mean, there's a lot of effort with the Office of Electronic Health Innovation.
Yep.
It has already contracted with Resultant to operate as a statewide health information exchange. And it seems like the underlying technology is going to be this FHIR data servers, blah, blah, blah. So for us to track that, we kind of need to know what decisions y'all are making. And so we appreciate transparency around that and opportunity to be involved in prototyping and testing those systems.
Thanks, Andrew. Yeah, that's great. And so we are super close with OHI, and they are very much a part of those conversations as well, because there definitely is connections to the SHE product, so the social health information exchange product, to our technology systems. And that even kind of goes back to what Alex Orloff was talking about in her response about OwnPath and the inclusion of providers beyond BHA licensing. So all super good conversations, and we'll make sure that like this is exactly the type of space to continue to talk about those, and for us to continue to provide updates to y'all. So thanks for bringing that up.
Another thing about bed tracking that I was wondering about was the acuity of the client that's coming in. So it seems like third parties like the police or referring agencies, like if our agency had a client who was highly acute, and we needed to make a referral to a residential or an inpatient, that the residential or the inpatient facility may want to know what kind of situation they're going to be dealing with, like whether that this is like cocaine-induced psychosis or this is chronic, somebody that's known to the system or something like that. And of course that's protected health information if it has identifying information along with it. So I was just wondering, to what extent do you let the referral target know the condition of the client that's coming in for the bed? Thanks.
Yeah, absolutely. And Andrew, speaking of research, I just dropped another research report that we did specifically on this topic. And so something to understand about this first launch of Client Care Search is that it will not have a feature to send referrals. It will have the ability for providers to update their bed availability, and then a bed search directory. So there's no messaging, there's no sending. It's simply an organization of information crafted to help care navigation. So very much you'll read in that referrals research the topics that we talk exactly to your point, and there's stuff down there, even down to the data model about how we're thinking about that. We actually came up with a solution that will likely launch in a few months, and we don't have a tight timeline around that. But those are all things that I would be able to talk to at the point where we're ready to release those features. But they're super good questions, and we have like that body of research to point to provide those answers. Thanks, Andrew. Great questions.
Great, thanks.
Yeah, Elizabeth, I see your hand.
Hi. Did you want feedback now about the ASO map, or do you want me to send it to you in an email?
If you could actually, I think the most helpful way to do that would be, did Melody provide her email here?
I'll drop it. I will drop it in the chat. Yeah. Elizabeth, if you want to email myself and Melody, because I think we both were working on like that page. So I'll drop
Okay.
both of our emails.
I'm actually glad that we had this meeting today, because I was getting ready to email somebody and I didn't know who to email about the map being taken off. So reach out to you and Melody. Got it.
Awesome. I'm glad you mentioned that, because it's oddly nice to notice that that page is being used and somebody noticed there was a change.
Yeah, it's actually used all the time
Yeah.
by the ASOs themselves, and it's used by the providers. And I've seen other external agencies use it as well when they're trying to just figure out what is an ASO. Like, I don't understand, why is somebody with an ASO talking to me? So.
Right. Yeah. Well, that's super helpful. So yeah, send us both an email and then we can chat and figure out a next step.
Sounds good. Thank you.
So we have a number of providers working on their essential safety net provider applications, and they're relying on Rule 502-1. So we're on the rules page a lot, and it looks like it changed last week. So just curious about the update about 502-1, and if there's any substantial changes to the rules, or is this just a reorganization of the rules, and when we can expect those things.
Yeah. We can't answer that in terms of the Rule 502. I was working with the licensing team to make some of those updates to the pages. My understanding, at least, is what was done was obviously like a redesign of those pages, but I can send you an email with the licensing team on it, to kind of continue that conversation a little bit further, if that's okay. Do you want to drop your email into the chat, Andrew?
I have Andrew's email too, so I can send that to you. Oh, there we go.
Okay, great. Thank you. And you said it was a 502-1, right? So was the one you were referencing?
Yeah, and this is chapter 12, chapter 8, chapter 2, which are required to write the application for the essential safety provider. And our assumption is that there's no substantial changes, that we just need to write to those rules.
Okay.
And hopefully that's true. Okay.
Okay, thanks. Yeah, I will email you with the licensing team. Okay, well, we will, there's about 4 minutes left in our normal timing for office hours. Again, we will stay on for 4 more minutes. If anybody has questions, if you don't have any questions, you are free to leave.
I think we're good, Amanda.
All right, sounds good. Thanks, everybody. We're gonna end this call. We'll see you next month.